On April 1, 2026, a cruise ship left Argentina carrying 150 passengers. 5 days later, a 70-year-old man developed a mild fever. Within 24 hours, he couldn't breathe. By April 11th, he was dead. This wasn't a movie plot. This was the start of a global hantavirus cluster that left doctors baffled as the virus moved through the ship. But here is the scariest part. The real risk for you isn't on a ship far away. It's sitting in your garage. It's waiting in your basement. It's hiding in that storage shed you're planning to clean this weekend. We're talking about a virus that kills nearly 4 out of every 10 people it infects, and it kills them fast. Today we're explaining HPS. We'll cover the symptoms that mimic the flu, the biological hijack happening in your lungs, and the 5 specific actions you must take this week to stay safe. As we do that, like the video, subscribe to Green Health Channel, and turn on your notification bell to get notified when there's a new upload on this channel. Hantaviruses are a family of viruses carried by rodents. In North America, the main villain is the deer mouse. In South America, it's the Andes virus. These rodents aren't sick, they look normal and behave normally, but they shed the virus constantly in their urine, droppings, and saliva. When these fluids dry, the virus stays viable. It becomes dust. The moment you stir up that dust, you are in the danger zone. You don't have to be bitten. You don't even have to touch a mouse. You just have to breathe. Roughly 1/3 of victims never even saw a rodent before they got sick. So what happens when you take that one fatal breath? The virus particles reach the smallest air sacs in your lungs called alveoli. This is where your body swaps carbon dioxide for oxygen. The virus targets the endothelial cells. These are the cells lining your tiny blood vessels, the capillaries. Think of your blood vessels like a sealed pipe. The virus makes that pipe leak. Fluid from your bloodstream starts flooding your air sacs. Your lungs, which should be light and airy like a sponge, fill with fluid. This is pulmonary edema. You are literally drowning from the inside. What's worse is that your own immune system drives this damage. The inflammation response becomes self-sustaining. By the time you feel sick, the trigger has already been pulled. There is no specific antiviral that can stop it once it starts. Let's talk about the timeline, because it is a trap. The incubation period is long, anywhere from 1 to 8 weeks after exposure. You'll forget you even cleaned that shed by the time the symptoms hit. Phase 1 looks just like the flu. You'll have a fever, chills, and a headache. But there is one specific clinical marker: severe muscle pain. We're talking about deep muscle pain in your thighs, hips, and lower back. Many patients say it's the worst muscle pain of their lives. This brings us to the most dangerous part of the disease. In clinical medicine, we call it the false corner. Around day 4 to 6, patients often feel better. The fever drops, the aches ease up. You think you've beaten the flu, but you haven't. Your body is just reassigning resources to a crisis it hasn't announced yet. Suddenly, the breathing changes, a tightness in the chest, a dry cough, a terrifying inability to get air. When this happens, the treatment window shrinks to hours. Without intensive care, most deaths occur within 24 to 48 hours of this respiratory stage. Why it matters. Why are we talking about this now? The 2026 cruise ship outbreak proved that certain strains, like the Andes virus, can spread between people in close, sealed environments. While the risk to the general public is low, the risk for adults over 50 is rising. It's not because your immune system is old. It's because after 50, you are statistically more likely to own a second property, clear out a family home, or maintain a workshop. You are the one opening the cabins in the spring. You are the one sweeping the garage. Your familiarity with these spaces is your biggest risk factor. You've done this 100 times before without a problem, so you don't think this time is different. But it only takes one breath of the wrong dust. You can reduce your risk to near zero if you follow the protocol. Here is your essential action plan. First, seal the gaps. Mice can fit through a hole the size of a pencil. Use steel wool and caulk to block every entry point around your foundation. Second, air it out. Before you enter a shed, cabin, or RV that's been closed for the winter, open all doors and windows. Walk away for at least 30 minutes. Let the fresh air and sunlight degrade the virus. Third, wet cleaning only. Never, ever use a broom or a vacuum on rodent droppings. The broom is the most dangerous tool in your house right now. Spray the area with a 10% bleach solution. Let it soak for 5 minutes. Use paper towels to wipe it up while wearing gloves and an N95 respirator. Fourth, recognize the symptoms. If you develop a fever and deep muscle pain within 6 weeks of cleaning a dusty space, don't wait. Go to the ER and say these exact words: "I am concerned about hantavirus exposure." Early diagnosis and support like ECMO can raise the survival rate to 80%. Late recognition is what costs lives. Don't let an ordinary Saturday turn into a medical emergency. Take care of your lungs. Take care of your home. Like the video if you found this helpful, and subscribe to Green Health Channel, and share this with someone who needs to hear it. Stay safe. Green Health cares.